So when the protein came back, we had to restart therapy, and you had been off therapy for a year.
Right.
You chose to not be on maintenance, as we have discussed. We tried this oral regimen with the ixazomib, lenalidomide, dexamethasone. You had these toxicities with a very profound fatigue and the nausea, and it just didn't work out for you. So then we said, let's see what other options there are. And I said we could do one of the new monoclonal antibodies. So the daratumumab monoclonal antibody was one option. And I said to you, it could be given in combination with either an immunomodulatory drug, which is the lenalidomide drug, or it could also be pomalidomide, which is a related drug. Or it could be given with the proteasome inhibitor bortezomib. The alternative would be to give it as a single drug, daratumumab alone. And we talked about this.
Yes.
And I said to you, if I look at the literature, the combinations are more powerful, there's more efficacy there. Unfortunately, you also have a likelihood of toxicity. And we talked about that. And
Yes.
I asked you, what did you feel was the right thing for you? And you said you want to try the single drug.
Right, right. Being that I had such adverse effects with everything else that I've taken, I decided to go with that.
So I think the discussion you and I had was that if we pick a combination and if it works, that's great. But if we pick a combination, you have toxicity, then we have to start peeling back drugs.
Right.
And on the flip side, we could also start single drug. And if that works, that's great. If it doesn't, then we can add in drugs.
Right.
And then you said, I want to do single drug. And that's what we did.
Right.
So we have given you the daratumumab by the FDA label. So you got 8 weekly doses, and then you got 8 doses every other week. And now we're into monthly infusions.
Right.
Now when you're on the daratumumab infusions, what's your experience during the infusions and maybe after the infusions, and have they changed over time?
Well, I noticed that the first infusion was very, very long. It was longer than what the other infusions have been. That's because I was told that that was because of the side effects that you can get, and they had to go slowly, very slowly in administering it. My experience with it was I started to feel redness or heat in my face, and then the nurse saw that it was red, and she lowered the dosage, until I was okay again. Other than that, all the other infusions have gone very well. I haven't had any other symptoms or negativities or anything like that. So, and the only drawback to that is the time. But like I said, I prefer that than to having anything else at the moment, because it works for me.
So the reaction you described happened for you the first dose?
Only for the first dose, never again.
And if I look at the literature, if I look in my own practice, it's the same. It's about 50% of all patients who receive the daratumumab, the first dose, they have some type of reaction to the drug, an infusion reaction. And after that, it just does not seem to come back. So that's what you tell us about. I can tell you that at our institution, we are now about to change the infusion time. So we're going to start doing 2-hour infusions from the 3rd dose and onwards. So that is how we are moving forward. And this is in accord with new data from the ASH meeting of 2018, which is the biggest hematology meeting every year here in the United States. What's your thinking? You are now on a regimen where you have to come in and get an infusion. It's not just taking pills on your own.
Right.
Is that an inconvenience for you, or is it just...
No, not at all. It's no inconvenience. No. I look forward to it because I know that that's something that's helping me. So I look at it in that light.
So if you have the option, like picking an oral regimen in your particular case versus an infusion, the toxicities last for a short period of time and then it's done. So that's what you would prefer.
Yes, exactly.
Different people have different opinions. Some people, they like the freedom of taking tablets. Some people like that it's kind of short and then it's over with the toxicities if there are for a few days. So I think it's good that there are options. There are different options to choose between. So how are you feeling overall right now?
Well, I have days that I feel better than others. When I have my treatment, like I say, like the first 2 or 3 days, I'm good. And then after that, I start to feel a little achy. My body starts to feel, my back aches, my legs ache. I feel that if I touch my body, I feel my nerves. But other than that, I've been great. I've been great with this treatment. I really can't say that I've had too many negative things happen to me with this treatment. I'm functional. I'm not fatigued at all.
You're traveling and you're very active.
Yes, I'm able to do a lot of things that I wasn't able to do previously when I had the oral medications.
You were in Florida just recently.
I was in Florida.
And I know you're going to California soon.
Yes. So I'm getting out there because of this treatment.
I'm very happy for you.
Thank you.